Hello, I'm Dr. Israel Barken, the Medical Director of the Prostate Cancer Research and Education Foundation. At this time, I would like to talk about a subject that doesn't seem to, topic that doesn't seem to go away. It's always relevant to prostate cancer patients, but also it's very relevant to men, and that's testosterone. There is a recent article in the British Journal of Urology International, February 2015. The topic is testosterone therapy and cancer risk. The authors are from Stanford University, Dr. Eisenberg, but the work is done in Texas, in Baylor, and Dr. Lipshultz is also one of the co-authors or the last author on this paper. So the question is there any risk, not only with prostate cancer, but developing cancer, any cancer, for patients that are on testosterone replacement? And I must say, testosterone replacement means when the testosterone is low and the patient is also symptomatic or has finding, then it's very justified to give testosterone to patient. What's unique about this paper that this is a long-term, 15 years, and is the longest study done in the US. There was one study done in England with similar results for a period of 20 years. So let's look a bit about this study. The shortcoming of it is that it's a retrospective study and not a prospective study, and it's not really a placebo-controlled study. So let's look at the information that we got here. The objective is to determine if testosterone therapy status modifies a man's risk of cancer, not only prostate cancer, as I said. The urology clinic hormone database was queried for all men with a serum testosterone level and chart examined to determine if testosterone therapy status. Patient records were linked to the Texas Cancer Registry. I must say, when review the level of testosterone, the mean testosterone prior to treatment was low 300, and average after treatment was in the mid or low 500. So there were not very high level of testosterone. Nevertheless, some conclusions were made during this study. There was no connection between the level of testosterone and developing cancer after that. There was no difference between people that were on testosterone or were not on testosterone in the incidence of developing cancer. So this issue is very important for men because the treatment of giving testosterone therapy is not only for correcting numbers, it's to try to improve the well-being of men, their strength, their feeling of well-being, and also dealing with issues like fertility. The age group here actually started from 40 and above, so there were also younger men that for them testosterone is important, and for the younger men it's also important to know 20 years from now, what will be the risk of developing cancer? And the overall conclusion is this. There was no change in cancer risk overall, or prostate cancer risk specifically, for men 40 years older on therapy. And the therapy majority was testosterone patches, and some of them got also shots. The ratio is like 70% were on patches, where 25% were on shots. I would say that it is very important to differentiate between men that take testosterone in a non-supervised way, trying to increase their testosterone level, supposedly it will make them supermen, versus men that have lower level of testosterone, are clinically and symptomatically and finding-wise are really lacking testosterone, and the testosterone is giving us replacement. I'm sure this issue will come again and again, but for the time being, there is no evidence that being on replacement testosterone will cause patients with prostate cancer to be in any trouble or have more recurrent disease, and those that don't have prostate cancer, they will not develop cancer more than anybody else in the population. Thank you for listening. For any question, please call us or write to us at 619-906-4700. That's the phone number of the foundation. or with question you could send an email to info@pcref.org. Thank you for listening. Stay well, be informed, and have fun. Goodbye.